can I just start with an overview of your personal experience with GLP-1s and some of the benefits that you've seen?
So I had to make a decision a couple months ago. I had a couple health things happen over the past actually 3 years, but then I had a series of surgeries last year and gained weight. And I was clinically obese for the first time in my life. So my doctor had a discussion with me about GLP-1s and do you want to try one? And I had some opinions at first because I was very concerned about what we see in the literature that patients are, at risk for losing muscle mass. And that was something my muscle mass was already low. So I didn't want that to happen. So after a long discussion and consultation with my physician, I did decide to go on one. And it's really the best thing I ever did. I've been on over 6 months and have had excellent results. But we had a really strong plan. And I think that's what I'd like to tell you more about is what that plan looked like.
Yeah, I would love to hear how you worked with your doctor as well as with your background working in the medical field to develop a holistic approach to this journey for yourself.
So that involved, so I'm a physical therapist by training, and obviously my world is muscle and exercise. But it's also collaborating in sort of, I created a multidisciplinary team. So it was my physician, a dietitian, and myself as my own physical therapist. And it really involved that three-prong approach of utilizing the medication, but also having really good goals set from a nutritional standpoint. You cannot just go and wing it with GLP-1s. GLP-1s, one of the issues is they take away your appetite. They really do. They sort of turn off that signal from your brain that you're hungry. And so actually eating enough can be a problem. And if you don't eat enough, your body gets the energy it needs from your own body. And that's not good. And that's how people lose, that's one of the ways people lose muscle mass. So it was having the really strong dietary inputs. I also tracked and trended everything I did. And I also have access to something called bioimpedance spectroscopy, which is a technology that can non-invasively measure the fluid in my body and also the tissue. So I could get a good sense of what the fluids in my body were doing and the skeletal muscle mass and the fat mass. And so we tracked and trended that every week. And I also saw my doctor for sort of a 3-month checkup to check my blood work. And I feel like all those things are really important for someone to have success like I have had.
I want to get into that a little bit more about the importance of understanding what you're doing to your body and the potential side effects. What were the side effects that you were most concerned about before you got onto a GLP-1?
So I would say the muscle mass loss was the biggest one because as a postmenopausal woman, I already have decreasing muscle mass. It just happens as we age. And I couldn't afford to lose any more. So I was really concerned about that. So again, you have to match the resistance training with the dietary inputs for the GLP-1 not to have that negative impact. And I think that's something people don't realize some of the other side effects. Some of the most common ones are things like nausea and constipation. I experienced both of those, and they are not fun side effects. So when you feel nauseous, you don't want to eat. So you actually now have two things that are telling your brain not to eat. One is your brain itself says it's not hungry, and then you feel nauseous. So it was really important for me to be able to track like my water intake. I actually started using an app in the beginning. I actually found pen and paper worked better for me. I used a dietary guide one of my dietitian colleagues had developed for other purposes, but I augmented that to use it for my purpose. And it was great because I could put my symptoms down. And then I called the doctor, said, "What do I do about this? I'm having this symptom. I've never had symptoms like this before. What should I do?" And so we came up with good plans. And a lot of them, fortunately, involved things like I eat prunes every day now. And you laugh at that, but that's an important thing because the dietitian said, let's not just turn to a medication, another medication to deal with the side effects from the GLP-1, but let's actually turn to like something you can really control. I think that feeling that I was part of this, it wasn't just the drug doing all the work. And a lot of people think it's just the drug doing the work. And if they go down that route and don't do all these other things I have been doing and continue to do, then they're really at risk for some of these long-term side effects like the muscle loss. And that's very hard to get back once that happens, especially at my age.
When I think about your relationship or your experience with GLP-1s, it seems like you come from personally having a lot of knowledge in the space, as well as working with a team of medical providers to help guide you through this monitoring, tracking what you're going through. For people who don't have the same access to that, what potentially could that mean for them in their experience if they aren't aware of the side effects, if they're getting on a drug and they are not necessarily working with a team like you have? Could that mean that their experience is not necessarily as positive?
Oh, absolutely. And one thing is, if they're not being tracked and trended by some measurement of like their body composition, they may not realize that people actually lose a lot of water in the beginning. So I was able to track that because the bioimpedance tracks that. And you have to account for that. So I had to increase my hydration a little, make sure I wasn't getting, dehydrated as I was going through the process. um, Energy levels can sag. If you're not eating and you're not getting enough energy, your body just naturally doesn't feel like it wants to do things. And so sometimes exercise may feel counterproductive. And the research coming out of the exercise field, so my background is really in oncology space. So people going through cancer treatment, we know exercise is one of the most potent medicines that they can now use. And the science is really starting to come out about that. And I think with GLP-1s, the same thing. Listen, GLP-1s are hopefully going to be more than just about weight loss in the future. There's a lot of research going on right now to show their powerful effects outside of just helping people maintain like glucose control. So things like, one of the big reasons the drug started was to help people with diabetes, like get glycemic control. But now we're seeing it used for other things because it's got a potent anti-inflammatory impact on the body as well. And that is one of the other mechanisms of action. And so we're starting to see that grow. And so, for me again, being able to feel the impact, and you do feel the impact of the medication. Like I knew I was on a medication, but having that team to support me was critical. So I do think we need to, whether it's through legislation or through just better awareness campaigns, we have to find something to help support people who may not be getting that support initially. Or I think we are going to see a lot of, bad effects from this in the future.
When you speak about the future of GLP-1s and the potential benefits outside of weight loss, uh, a lot of what we're talking about in this story is the accessibility and the way that people are obtaining these drugs. You can get them online. You can, fill out a form and qualify pretty easily. Are you at all concerned about the accessibility of the drug right now?
Well, yeah, I mean, so once I decided to go on one and, was even talking about it, my social media accounts just blew up with ads for for GLP-1s. And now I chose to go through my doctor and through those channels. I just felt better about doing that. I will say I was pretty impressed with the information the company sent me. So the company the drug I got, they sent really good information. Like it was one of the best patient information booklets. And again, I've got a good provider. She walked hand in hand with me to make sure I was, getting educated. Um, but I think it's a problem if people's only education is coming from social media. And I'm the first one to say a lot of good things. I also am a lymphedema specialist, and we've really relied on social media to help gain awareness for patients about a disease like lymphedema that is very complicated. And so I think we just have to find that balance in social media. And I think we're gonna need some advocacy right now to help maybe get that balance.
Talk a lot about the tracking and trending that you're able to do with yourself. Talk to me about what you learned about how your body changed over time. Anything that stood out to you throughout the process, either like physically or psychologically, as you spent more time on the drug.
That's a great question. So, one thing I'll put out there is I had a plan and I wanted to make sure. I'd heard all these stories about people losing massive amounts of weight, like in the first 2 months. And I knew just from all the research I'd done, that's never going to be good because likely they're tapping into those muscle stores. So remember, I talked about having to balance the nutrition with the exercise. So my goal was a slower, steadier weight loss. And I will say I had a friend who was doing it at the same time, and she was like losing a lot more weight than I was, but we weren't really doing it the same way. So I just had to kind of sit back and trust the process because, at first when you get on this again, you sort of lose your appetite, then you maybe aren't feeling good with some GI stuff. A couple weeks in, when I started to have other symptoms, I didn't really want to eat. It was really hard to make sure I was getting the calories in. And again, my dietitian had set like a minimum I needed every day. And that's critical because a lot of people don't realize that if you go below a certain amount, then your body, again, like I said, it feeds off itself, and that's never good because you can lose tissue you don't want to lose. So I think it was just trusting that process that some days your body just picks up more fluid than others. Like a single meal can change it. I ate out one time at a takeout restaurant and my fluids really jumped up and my weight stayed up for a couple days. And I had to just trust the process that my body would take care of that. So for me, being able to track and trend some of those was very important. And again, I would in my diary just say, okay, I have a little weight plateau. It's okay. Your body, just give your body another week. And sure enough, each week as it went by, it just kept progressing. But you have to have a little faith in that system that you don't want to necessarily go for that big number drop in the beginning. And it's really that slow, steady, because you have to also change your lifestyle at the same time. And I didn't have a terribly bad lifestyle, but I now started to prioritize things like my weight training got prioritized. Like it has to be twice a week minimum. And you really have to, kind of you want to get these muscles firing, right? Because those muscles, when they're working, they're signaling my body for other things too that are helping. And I think it actually even helped a bit with my appetite of just stimulating my appetite, saying, okay, now I think I can eat a little bit more. I had to schedule my meal times because I really had to make sure I got a certain amount of protein for breakfast, lunch, and dinner, and then protein snacks in between. Again, that was according to my dietitian. She didn't want me to get it all at once. You can't just not eat all day like I hear people talk about and then eat a big meal at dinner. So I think it's that education, but that's what helped me and kind of in it for the long run.
We were speaking about the body composition work. I'd love to give you a chance to sort of explain what that is and how that the technology that you work with could benefit someone who is thinking about trying to take on this process of having success with a GLP-1.
Thanks. So the technology is called bioimpedance spectroscopy, and it's just a low-level electrical current. What makes our technology different is we're sort of medical grade, so we use 256 different frequencies. You don't feel these, they just go through your body really fast, but they're very accurate at getting fluids. So we're FDA cleared for healthy and unhealthy individuals. So technically, I had some medical conditions, I had clinical obesity. So I was the perfect patient for that to be on this technology. And the hope would be, it's in physical therapy offices, it's in a lot of doctors' offices. And I think with the growing trend with GLP-1s, it's going to be really important that if you are looking for someone to help you on this, that they have some kind of technology like that to do that tracking and trending. So it was super easy. I'd stand on it, a 30-second test with my shoes and socks off, and then we'd be able to go over all the data and kind of see the trends that were happening. And that was again important to track and trend yourself over time so that I wasn't seeing like some, really fast weight loss, then it would slow down. I had a very steady weight loss the whole time. And I think it was because of having data, and we have data everywhere today. And I think we just need to find really positive ways to use it. I tracked my steps on my watch. I tracked my sleep on my watch and add those things into your process. And I think that's what people should be looking for. So look for someone who's not just going to write you a prescription and say goodbye, but who's going to help you find those resources to get to someone who can make sure you're exercising correctly, eating correctly, doing all those other lifestyle things. And psychologically, I can just speak for myself that it has been just one of the most amazing experiences. Again, I was fearful going into it, but now I'm looking back and I'm so glad I made the decision. I'm glad I got good advice from my doctor about it, because I also have a history of heart disease in the family. So she was saying, look, this is where the research, what you were asking about other uses, well, they're starting to see some benefits with cardiovascular health. And so she thought it just was a great thing for me for my overall health and wellness. And it's really showed up. So I'm excited for my next visit because I won't be clinically obese next time I go there. I'll still be overweight, but I'm focusing on function and, you know, incorporating exercise and healthy eating into my lifestyle. And it's great because I hopefully can pass it on to other people as well.
It sounds like in your experience, it really kickstarted a lot of different health changes and advancements. And I think in some cases, that's contrary to where maybe this drug is advertised as sort of this miracle drug that it just does it for you. Any kind of final thoughts on the importance of knowledge going into being on a GLP-1 and also maybe demystifying some of what people might think is you take this and all of a sudden you just lose a ton of weight?
Yeah, I think demystifying it would be a really important thing. I think we have to have really honest conversations about what weight is. Obviously, you know, social media with AI and all the things, people put a filter on and try to show this best version of themselves. You know, we have to be really honest about what does a postmenopausal body look like, for example, and have a really good acceptance of that. I, as a physical therapist, really prioritize function and mobility over what your body shape looks like. My body shape was never, you know, the archetypical shapely body. I was built like a fire plug from the time I was 5. So I've always had to just accept that I'm short, I'm stocky, I've got great muscle build, I'm very strong, and we have to make sure people gain some self-acceptance. And if people are struggling with that too, I think you sort of mentioned psychology before. I'm not a psychologist, but as a physical therapist, I've recommended to a lot of patients to talk to their doctor about getting help. If they're struggling with their body image or you know, being on the drug or even being, a lot of people are ashamed to be on these drugs and they shouldn't be. I mean, this is modern medicine really attacking a worldwide problem that we're having. And I hope people can be more open about it so that there's better communication, so people avoid maybe getting it places where they shouldn't get it and realize it should be something that they get through their health care provider. And that health insurances should be paying for this too. I think we need a lot of advocacy around that. It shouldn't be something that, you know, I'm lucky enough that I have the money to buy this drug because I otherwise didn't meet the indications for it. So I hope we see an expansion of that, expansion of advocacy and support for patients who can make a decision with their doctor that this is the right thing.
Thank you so much. This was so insightful. Is there anything else you want to add or you feel like we didn't cover?
No, I just, you know, for me, the final thing I'll just say is, you know, exercise and movement is really the key to life. And make sure that if you get on a GLP-1, that that is one thing that gets prioritized because it's probably one of the most important things that why this drug will work well for you. So thank you for the opportunity.